Good morning, everyone. When we talk about fertility and age, what's the first thing that comes to mind? If you're like most people, you're thinking about women and the biological clock. But here's what science now tells us. Men have a biological clock too. For decades, we've operated under the assumption that male fertility remains constant throughout life, that men can father children well into their golden years without consequence. But recent research paints a very different picture. Today, I want to share with you why male age matters in fertility, not just for conception, but for the health of pregnancies and even the children themselves. The biological reality. Let's start with the basics. Yes, men produce sperm continuously throughout their lives. But production isn't the same as quality. Starting in the 30s and accelerating after 40, several critical changes occur. First, sperm-producing cells divide millions of times over the years. Each division increases the risk of DNA copying errors, like making a photocopy of a photocopy. Second, hormones fluctuate. Testosterone declines by about 1% per year after age 30. Follicle-stimulating hormone and luteinizing hormone, both critical for sperm production, become less stable. Third, testicular tissue loses elasticity and blood flow, reducing efficiency. And finally, oxidative stress increases. This is when unstable molecules called free radicals outnumber the body's antioxidants, directly damaging sperm DNA and membranes. The result? Sperm that look normal on paper, but carry hidden defects that affect fertility. The numbers don't lie. Let me share what the research shows. On conception, couples where the male partner is over 40 take 5 times longer to conceive compared to couples where the man is under 30. On pregnancy loss, the risk of miscarriage rises by 30 to 50% when the father is above 40, even when controlling for the mother's age. On assisted reproduction, IVF and ICSI success rates drop with increasing paternal age, regardless of how young the female partner is. But here's the invisible threat: DNA fragmentation. Traditional semen tests can't detect it. A man might have a perfect sperm count, excellent motility, and normal morphology, but if his sperm DNA is fragmented, conception becomes difficult and miscarriages more likely. Studies show DNA fragmentation rates can double between ages 30 and 45. When fragmentation exceeds 30%, the chances of both natural conception and IVF success drop dramatically. This is why couples sometimes face unexplained infertility despite normal reports. The genetic integrity simply isn't there. Beyond conception, impact on children. Now, this is where the conversation becomes even more important. The effects of paternal age don't stop at conception. They can influence pregnancy outcomes and the child's long-term health. Children born to fathers over 40 have a twofold increased risk of autism spectrum disorder, slightly higher rates of schizophrenia and bipolar disorder, higher chances of single-gene mutations like achondroplasia. Additionally, advanced paternal age is associated with higher rates of preterm birth, lower birth weights, and increased pregnancy complications for the mother. Now, let me be very clear. Most children born to older fathers are completely healthy. These are relative risk increases, not certainties. A father at 45 doesn't doom his child, but awareness allows for informed decisions and appropriate prenatal care. The health mirror. Here's something fascinating. Sperm quality is actually a mirror of overall male health. When fertility declines, it's often an early warning sign that something else is happening in the body. The same oxidative stress that damages sperm also damages the heart. The same metabolic problems that reduce testosterone also increase diabetes risk. Conditions that affect fertility include diabetes, which damages blood vessels and nerves, high blood pressure, reducing blood flow to the testes, obesity, creating hormonal imbalance, cardiovascular disease, introducing system-wide inflammation. This is why doctors increasingly view semen analysis not just as a fertility test, but as a health screening tool. If your body isn't healthy, your sperm won't be either. And here's where lifestyle becomes critical. Age is inevitable, but lifestyle accelerates its impact. A 45-year-old man who exercises regularly, eats well, doesn't smoke, limits alcohol, and manages stress can have better fertility potential than a 35-year-old with poor habits. Smoking increases DNA fragmentation. Obesity causes hormonal chaos. Poor diet strips away the antioxidants sperm need for protection. Lack of sleep disrupts testosterone production. The good news? These factors are controllable. What can be done? So what's the path forward? Let me break this into 3 parts: prevention, testing, and treatment. Prevention starts with lifestyle optimization. Eat antioxidant-rich foods, berries, leafy greens, nuts, seafood. Maintain a healthy weight. Exercise regularly, but avoid overheating the testes. Quit smoking and limit alcohol. Get 7 to 8 hours of sleep. Manage stress through meditation or therapy. For testing, men over 35 planning to conceive should consider comprehensive semen analysis, sperm DNA fragmentation testing, hormone profiling, scrotal ultrasound if needed. Early detection means early intervention. For treatment, options have never been more advanced. Lifestyle modifications often improve results within 3 months. Hormone therapy can restore balance. Surgical correction for varicoceles or blockages. Assisted reproduction, IUI, IVF, or ICSI, tailored to specific needs. Genetic counseling and pre-implantation testing for older fathers. Modern medicine can work around many age-related challenges, but earlier action means better outcomes. Changing the conversation. Let me bring this full circle. For too long, fertility conversations have focused exclusively on women. That narrative isn't just incomplete, it's harmful. It delays diagnosis, increases emotional stress, and prevents couples from getting the help they need. The truth is, fertility is a team process. Male age matters just as female age matters. When both partners are under 35, conception rates exceed 90% within a year. When the man is over 40, even with a younger female partner, that rate drops by 30 to 40%. But knowledge is power. When couples understand that male fertility declines with age, they can plan proactively rather than reactively, seek testing earlier, make informed lifestyle changes, access treatments sooner. We need to normalize conversations about male fertility, remove the shame, guilt, and denial that too often surrounds it. Because reproductive health isn't just about making babies. It reflects overall vitality, longevity, and well-being. Gentlemen, like the video, share the video, and do subscribe our YouTube channel. Take care of your body. It will take care of your future. Thank you.